Dear APPNA members, Assalamu alaikum, Ramadan Mubarak. It is unbelievable that it has been just 1 month since APPNA focused on COVID-19 initiatives. Much has been achieved both here in US and Canada and in Pakistan. First, my salute to the 18,000 Pakistani Americans and Pakistani Canadian physicians for your steadfast commitment to treat COVID-19 patients under highly hazardous conditions. In New York, New Jersey alone, approximately 40 APPNA physicians have contracted the virus and one senior physician has passed away. He felt it was his duty to treat his suffering patients, the ultimate sacrifice. I will break today's message into two parts. First, a summary of APPNA's COVID-19 relief efforts, then a spotlight on COVID-19 relief efforts for our chapters and alumni. APPNA has raised a total of $599,000 to date. There will be an APPNA telethon on April 26th from 5 to 7 p.m. on TV1. Please join us in the holy month of Ramadan and give generously to COVID-19 relief efforts. Dr. Aisha Zafar, Chair, Social Welfare Disaster Relief Committee, and Dr. Sajid Chaudhary, Chair, COVID-19 Task Force, with the support of APPNA EC, continue to build on our US, Canada, and Pakistan initiatives. For Pakistan, APPNA has sent $95,000 for food rations, which are being distributed in all 4 provinces, not just in major cities, but also in remote areas and minority communities. Our partnering NGOs include Ahuwat, Selani, Al-Khidmat, and Helping Hands. Alumni associations have partnered in this endeavor, including Khyber Alumni, King Edward Alumni, Jinnah Sindh Alumni, and Qaid-e-Azam Alumni. $20,000 worth of personal protective equipment has been distributed to hospitals across Pakistan, including Mayo Hospital, Sir Ganga Ram Hospital, Jinnah Hospital, Services Hospital, Lahore General Hospital, Punjab Institute of Cardiology, JPMC Karachi, Bolan Teaching Hospital, Gujranwala District Hospital, Skardu DHQ, Gilgit DHQ, Dera Ghazi Khan GHQ, and Mazang Hospital. Nishtar alumni sent $25,000 directly to Nishtar University to purchase PPEs locally. Qaid-e-Azam, a medical alumni, also sent $7,000 for PPE for their alma mater. APPNA has distributed worth $62,000 through APPNA and other local food pantries all over US. APPNA has been distributing thousands of N95 and KN95 masks, face shields, and gowns, especially in New York Hospital, worth $82,000. PPEs have been coming in batches, and APPNA has been distributing them as they arrive. APPNA Merit webinars for Pakistan on management of COVID-19 patients have been occurring daily. 23 days of daily live webinars, 90 minutes each, held at 11 p.m. US Eastern Time and 8 a.m. Pakistan time, have already been held by APPNA Merit since March 31st to enable real-time transfer of knowledge on this new disease. The webinars bring together doctors in Pakistan and US to share best practices in taking care of COVID-19 patients. COVID-19 management has been addressed from different specialties, including infectious disease, critical care, pulmonology, cardiology, nephrology, GI, psychiatry, and many others. Faculty has presented in this from Mayo Clinic, Harvard University, Northwestern University, Methodist Houston, Mount Sinai University, New York, Seton Hall, New Jersey, Indus Hospital, AKU, and many other institutions. All webinars are recorded and are posted on appnamerit.com. APPNA doctors in US and Canada may also find them useful and informative. Please publicize them to your doctor friends, both here and in Pakistan. Visa advocacy for incoming Pakistani residents in training. I was heartened to receive an email from an incoming resident on Sunday from Karachi letting us know that almost all incoming residents have now received their required statement of need from Pakistan government after extensive APPNA advocacy. PMDC's legal issues had put residents in limbo for this essential paperwork. Our advocacy with Pakistan's Federal Health Minister, PM's Health Task Force Chair, and Pakistan's Ambassador finally bore fruit. We have also been working with ECFMG and US Ambassador and Consular Section Head in Pakistan, as well as State Department desk in Washington, D.C., to ensure that the 200 incoming Pakistani residents will be able to join their training in time. APPNA's chapter and alumni relief work with APPNA matching funds. So chapters and alumni associations have been active across US and Canada raising funds and implementing their own COVID-19 relief projects with APPNA's matching funds, dollar for dollar for personal protective equipment and 50 cents for each dollar for food aid. APPNA is also helping purchase PPEs at bulk rates and sending it to chapters who have already distributed 7,000 KN95 and N95 masks to 10 different hospitals and clinics across New York, Georgia, Minnesota, Oklahoma, Florida, and Texas. Chapters are working in their communities on many fronts. Number one, distributing food to the indigent, providing personal protective equipment to local hospitals, meals to the first responders, staffing psychosocial helplines, holding community awareness seminars, providing free COVID-19 testing, and volunteering physicians to supplement staff in overwhelmed hospitals. And of course, contributing to Pakistan relief efforts. There have been fundraising for the APPNA COVID-19 relief. Let me recount our chapter's efforts, starting with one of our Canadian chapters. Alberta has raised over $13,000 for Pakistan relief efforts and Calgary Food Bank. Alabama chapter raised $7,000 with APPNA match for PPEs in Alabama. Dallas KE doctors distributed 100 lunch boxes for Methodist hospital staff this week. DMV chapter held free COVID testing clinic, donated $11,000 to local North Virginia food pantry, $16,000 for PPE for local hospital, $18,000 for US food pantries, and $10,000 for Pakistani food rations. Georgia, $10,000 for food packages for 500 families in Pakistan, distributed in every province, including Gilgit. They provided 2,000 hot meals for first responders and healthcare workers in Atlanta and PPEs for the Atlanta hospital. Kansas Heartland chapter ordered PPE with APPNA match for local hospitals. Minnesota raised $9,000 with APPNA match for food and 2,000 N95 masks worth $7,000 for local hospitals. Dr. Nasser Qureshi, New Jersey, delivered 1,000 surgical masks to Robert Wood Johnson Health System, 200 KN95 to Schneck Medical Center, ER in Indiana. New York, COVID-19 helplines for New York City for Pakistani and Spanish-speaking communities in collaboration with ICNA Relief, donated $5,000 to ICNA Relief for food distribution, volunteered to distribute food to Pakistani communities, lunch and dinners to first responders in different New York City ERs and ICUs, $7,000 for medical supplies and food for Pakistan. New England chapter donated $2,000 to Worcester Islamic Center and Natick Food Pantry. They co-hosted webinars on COVID-19 and have a mental health hotline. Ohio provided PPEs worth $7,000 to local hospitals with APPNA match. Oklahoma provided $5,000 worth of PPE with APPNA match to Oklahoma provider. $7,000 with APPNA match was donated to local pantry. APPNA provided PPEs for $3,000 with APPNA match to local providers and provided food to local needy families worth $5,000. South Florida provided PPEs with APPNA match worth $3,000. They provided food from food pantries for 500 families, $1,000 to South Florida food for $1,000 for the food rations, and many others. South Texas donated $4,000 to Pakistani Association of Greater Houston and $1,000 to the Islamic Society of Greater Houston for food rations. They also contributed for food rations in Pakistan and provided PPEs to Harris County. St. Louis, $4,500 were raised for PPE, and they are running APPNA free clinic. They also are establishing free COVID-19 testing. Wisconsin provided KN95 masks, surgical gowns, face shields worth $6,000 for different hospitals, clinics. Food was provided to the first responders at the local hospitals, and kids volunteered in soup kitchen. Now an update on COVID-19 relief work by our Alumni Association. Kemkana raised $62,000 for COVID-19 relief in addition to KE alumni from AKU, Allama Iqbal, KE alumni of UK, and friends donated. They worked hand in hand with APPNA to send PPEs to New York City Hospital and Mayo Hospital Lahore and food rations both to US and Pakistan. Rawalpindi medical alumni have provided $8,000 worth of PPEs to Rawalpindi hospitals and $3,000 for food rations in Rawalpindi. Jinnah Sindh medical alumni have provided $10,000 worth of PPEs to Jinnah Postgraduate Medical Center in collaboration with Karachi-based Sindh medical alumni. They worked closely with APPNA to provide another 1,000 N95 masks, 1,000 KN95 masks and face shields to both JPMC and New York Hospital. $7,000 with APPNA match was sent to food pantries in US. Qaid-e-Azam medical alumni sent money, $7,000 for the PPEs and $14,000 for food rations in Bahawalpur. I thank all of our chapters and alumni leaders and activists for their selfless work in providing relief during this pandemic. What I've covered today is not an exhaustive list of all that APPNA component societies are doing. Our membership can be rightfully proud of this joint effort, and we thank all our donors for their generosity. Wishing you a peaceful and spiritually nourishing Ramadan